Now, our next guest was diagnosed with breast cancer in her mid-30s, shortly after marrying the man of her dreams. And unlike other women in her situation, it wasn't finding a lump that alerted her to this disease, which had already reached grade 3.
Last year, we followed her as she underwent her final bout of radiation therapy, and we're joined this morning by cancer survivor Orlagh Winters. But first, let's take a look back at when we spoke to her last year.
I didn't expect ever to be celebrating my first wedding anniversary while going through chemotherapy, and I finished chemotherapy 5 days before, so the side effects were pretty severe. I was quite sick. We celebrated in Galway, where we'd had our wedding, so it was nice to go home and see family. But all day I said, this time last year I was doing this time last year, so yeah, that was tough. And hopefully the next time that I come to CUH, it'll be to the maternity ward and not into anything to do with oncology, chemotherapy, radiotherapy, because I've had it. But the one thing I will say is cancer is not something I'm afraid of anymore. It can be beaten, and if it comes back, I'll still beat it.
Orlagh, I know that was tough for you to watch. Your tears were welling up in your eyes. You've come a long way since that day.
I sure have, Sinead, yeah. It's, looking back at that, I can't believe I'm the same person. I know there's the old cliche, you know, what doesn't kill you makes you stronger, and that's certainly the way I feel. Yeah, tough time, but I'm out the other side of it now and feeling great.
So where are you exactly now, Orlagh?
I'm 1 year since my last treatment. I have ongoing treatment, hormone therapy. I'm still on the drug called tamoxifen. And I did, as a result of all the treatment, I did have back problems, which I still have, but you know, nothing compared to what I was back then. So yeah, I'm at the stage now where it's behind me. I'm a survivor, you know, and I knew from the first day that I had my operation, I was a survivor, and I'm delighted to be over it. But yeah, it's when I look back at that, I can't believe how far I've come. You know, I thank God that I am here. The NBCRI, who I am a great believer in, the research they do, you know, I've done lots of work with them throughout the year. Unfortunately, as you've alluded to earlier on, Sinead, the downside of me having the treatment is the fact that I've been told children are not going to be an option.
At all?
At all, yeah.
Now, you did know, embarking on the treatments, that it reduced your chances by about 60%.
And then when the tamoxifen, I was told I was going to be on it 2 years, and now that's out to 5 years. And just that the risk of cancer coming back is huge, so it's better for me not to
How was it dealing with that? Because
that
one of the things that you
tough.
said in our, I mean, you said, I'm going to beat this, but you know, because you have this beautiful man and you have this life mapped out for yourself, and central to that,
I was
as many kids as you could.
Yeah, I had the names of my boy and girl picked out. You know, I was going to have George and Maggie, and no one was going to mess with George or Maggie Savage. You know, this in my head. This is what I had. But you know, I guess life throws different things at you. I'm here, as you know, George has said to me many times, isn't it better to have you here than not to have you here and take the risk of having a child?
And there are many children who don't have families that you know, and so, I mean, that's obviously an option that you
Oh, absolutely. Unfortunately, with the way Irish adoption is...
it won't allow you to adopt.
And there isn't a lot of children going up for adoption anyhow. There's a huge shortage of children.
Well, that's for another debate, but I mean, it doesn't mean that you won't have a family.
Oh, it doesn't mean, absolutely not. No,
you mentioned your lovely husband, George.
Yes.
I want to know how he's doing, because we always talk to women who have been through breast cancer and have survived it. And I think it's interesting today that we're talking life after cancer as opposed to life with cancer, because I think after cancer can sometimes be just as tough as almost with cancer.
Oh, absolutely. You know, I think when you're in the bubble of doctors and medicine, it's very easy for you to get caught up, and then when that all goes away and you're left, and I remember a lady saying to me before it as something, she said, you know, when that's all gone, it's only your family you have to rely on, your friends and your family. And it definitely was a huge adjustment of not having the doctors saying, right, this is what you're doing this week. You know, this is, you know, because they planned your life for the time that you're going through your treatment. You know, they're saying, right, you're in the hospital for the next 3 days, or you're back up on Thursday, or, you know, So it definitely, your whole life changes again once your treatment finishes.
So you get your life back.
You do.
But do you want to live a different life now you get your life back? Have you reassessed your priorities and what you want?
Yeah, certainly. There's nothing I wouldn't do now. Certainly not. If somebody says, "Are we doing something this weekend?" Whereas before I say, "Oh, I don't know. I'm on for it. I'll do anything." Which I suppose, yeah, it does. It kind of gives you a new lease of life. And as I mentioned with the NBCRI, I try and attend as many things that they're doing. Like even yesterday now they had the T and the G with, Barbara Power, you're familiar with Barbara, she emceed it, and the fabulous Les Jumelles. Things that I would never have bothered with before, but now I'm going to it because, you get an interest. When you get your mojo, for want of a better word, back, you're interested in fashion, you're interested in clothes, you want to have the new hairstyle. Now that I have hair, which I must say, thanks to a fabulous project called Viviscal, I started using that and it came back.
Mind you rock the turban pretty well, I have to say now.
Thank you, thanks a lot.
The morning you were on with that, we got loads of comments going, God, she looks amazing.
You never lost the style, to be fair, Orlagh.
I didn't, but it's a lot nicer getting back into the clothes that fitted you, before you started all this. I tried to. I tried never to look sick.
Was that in the overall scheme of things, you have cancer and you're worrying about your life, the external things, the vanities really shouldn't matter. But when you lose your hair, and when it's your breast, and when it's your identity and your femininity, when all of that is up for grabs as well, that's an extra burden and very difficult to deal with.
Absolutely huge. And at the end of the day, a woman is much more than men. Your image is so important.
Matters.
Absolutely. I never thought I was going to be bald. I never thought I was not going to have eyelashes, eyebrows. But these are the facts that to get better, you have to look a lot sicker, But style is a huge part of a woman's life. So that was a huge aspect of it. And I know it sounds completely vain, but I was incredibly worried about my appearance.
It doesn't sound vain. No, it doesn't sound vain. It's part of who you are.
Yeah.
Looking well.
Thank you.
Goes towards helping to feel well.
Yeah, that's very true. That's very true.
And you are well at the moment.
I'm very well.
Back at work.
Back at work. And as I say, doing lots with NBCRI as well. And the one message, if I could give anything, is obviously it's Breast Cancer Awareness Month, is to get people to go get themselves checked. It is just so important.
Well, in your case, it wasn't a lump. It felt like an ill-fitting bra, and
exactly.
because the lump was underneath the breastbone.
Yes.
So, if you had ignored that, it was already at grade 3 by the time you got it.
Exactly.
If you'd left to go any longer, you wouldn't be here.
Exactly.
Well, I tweeted last night.
We're delighted that you are here, and it is lovely because so often we hear these stories and they have sad outcomes or it doesn't work out. But look at you.
Yep. Thank you.
There you go.
I did tweet last night that you were an inspiration. We hear that bandied about an awful lot, but I know that all of the women watching this morning will be thinking, God, she's something else.
I love the hair, by the way. The hair is so cool. I am envious and
jealous. Give our love to George. We wish you continued good health.
Thank you very much, guys. Thank you.
We will take a break. See you back here in a few minutes' time.